Hi everyone, I'm Dr. Z, and we're going to be learning about autism. I myself am on the spectrum, considered a level 1 diagnosis, and I have a bachelor's of science in biochemistry, a doctorate in naturopathic medicine, and I practice functional medicine. Let's talk about pathological demand avoidance, aka PDA, aka persistent drive for autonomy. Something that is very near and dear to me because I also have it as a PDA adult. I grew up as a PDA child, and it is a term recognized within the United Kingdom, but it doesn't have a formal classification here in the USA yet. It was coined by Elizabeth Newson, which was a British developmental psychologist in the 1980s. PDA essentially is something that describes a perceived loss of either autonomy or equality, and it's not due to some kind of rationale. A lot of people mistake PDA for demand avoidance, and not all demand avoidance is part of this very distinct PDA profile. Examples of what PDA generally is not include perfectionism, OCD triggers, cognitive overload, sensory issues, anxiety, task initiation difficulty, environmental stressors, negative past experiences, difficulty with transitions, time scarcity mindset, executive functioning challenges, lack of predictability, limited energy resources, routine disruption. These may be related to ASD or other diagnoses, but they are not directly related to pathological demand avoidance. It is a separate thing, but it gets confused a lot for those things. What PDA is also not, it is not defiance, it is not opposition, it is a threat-based nervous system dysregulation. It is where this perceived loss of autonomy activates the nervous system into a full-on threat response. And this can lead to a lot of communication mismatches between patients, providers, parents, children, teachers, students, like anything where there's hierarchy, essentially. And PDA can trigger sensory overload, executive dysfunction, meltdowns, shutdowns, avoidance, but generally the reverse is not the case. What triggers the PDA, which can trigger those things, is the loss of autonomy and loss of equality. A lot of times it's misdiagnosed as oppositional defiance disorder, and it looks like resisting and avoiding a lot of ordinary demands in life, or doing things in your own unique way to kind of like accommodate for your own PDA, and sometimes you may not even know that you're doing that. PDA people don't perceive social hierarchy, and an example of what this can look like is a child wanting to be a co-teacher or a co-parent to their parent. And because a lot of PDA people appear to be sociable on the surface, which causes them to be less likely identified as autistic for this reason. And lately, there are people who are trying to research if PDA is also a profile of ADHD and not just an atypical profile of autism. There have been no conclusions made, but there are people looking into this. And PDA people will tend to use social strategies as a part of their avoidance technique. So like being distracted or immobilized, or like suddenly something else matters more in the moment because they are constantly trying to bring autonomy back into every single decision that's being made. Another thing to understand is PDA is not like on or off sometimes, it is just on. It is a brain algorithm that is consistently persisting in every decision made all day, every day. If you think you experience it on and off, sometimes you don't have PDA in the way that it is a very distinct profile, and you may just have demand avoidance. And it can also look like obsessive behavior, and this can be found where there's usually a lot of focus on other people, and it can show up in the form of love or hate as well. Ways to approach people with PDA include low demand language and collaborative decision making, as well as some sensory adaptations to reduce potential additional stressors. An example to give is like when people sit around in a circle, like they're doing a circle share or something. Like I used to always sit outside of the circle because it felt like a demand to sit in the circle. Like I would always sit like in a weird spot, and I just didn't know why at the time. Like I was always doing things like this. Or I like to climb things everywhere I go because I like to be like in a higher position. And I have so many stories about climbing things and places and buildings. That's not for this channel right now, but it's to share again how like you are trying to achieve some sort of hierarchy, equality, autonomy all at once most of the time. There's a lot of examples with this. I'm going to do a whole course on this at some point as well on PDA specifically. So this is the general general rundown for you guys now to get started in understanding PDA and to understand how language plays a huge role in communication, changing communication to be low demand, and how it's truly a brain algorithm that we have essentially discovered and are learning how to communicate with. So thank you.